Ladies and gentlemen, VK and dignitaries on the dais, I do have to apologize as being one of the people who was late coming in and responsible for a delayed start, so my really sincere apologies for that. I'm going to talk about how unmet needs, whether especially in the health sector, becomes the mother of innovation, how needs are what actually drives innovation, and then go a bit into how technology is one of the solutions to address those innovation. And I think more and more as we work in it, and when we hear of, we heard a lot about the cybercrime aspect, we heard about us having to be aware of the risks of technology, but also mitigating those risks, and understanding that innovation is also not just about technology. Innovation is about solutions that are available for a problem that can be taken to scale, solutions that haven't been used before. And whether it's through technology or through some other forum, it's how do we reach scale? How do we reach the millions of people that we need to? And that's where I'd start with some reference to the 2030 Agenda for Sustainable Development. The world has resolved to leave no one behind. As we signed off on the SDGs, it's really important that we keep an eye on some of the commitments we've made to ending extreme poverty and preventable child deaths, and really looking at integrated action across all sectors to address some very complex issues that we face. The world, on the other hand, you can see that how increasingly connected we are becoming, how much more opportunities there are, especially when we look at the fact that 95% of the global population, which is about 7 billion people, live in an area that is connected by a mobile cellular network. Can you imagine? 95% of the global population can be connected, which is massive. And nearly 41% of people in developing countries have a mobile broadband subscription. And I think in countries like India and many places in Africa, it's not just one mobile connection. We have, how many people here carry more than one mobile phones with you? So there's so many connections that we see that are happening. So very clearly, if we are to achieve the goals for 2030, we will not be able to do so without really paying due attention to technology, to innovation and partnership, because we cannot work in silos. The different cellular companies, if they did not allow us to talk to each other across cellular companies, we would not be getting anywhere. So that partnership factor is going to be extremely important. Improve network speed, efficiency, cloud computing, device connectivity, data analytics. These are accelerating conversations with really a strong promise of digital health also. With digital health, we have an opportunity to invest in the policy, people, processes, and technologies that allow us to leverage data to improve health systems and health outcomes for billions of children around the world. The UN Secretary General in 2018 has also very strongly taken on the agenda of how we work with technology, especially for reaching the goals. And he's asked us to narrow the gaps, bridge the divides, rebuild the trust by bringing people together around common goals. Unity is our path, our future depends on it. And of course, if we are not healthy, then our future is not going to be looking very rosy at all. So why does good health matter the most and what are the unmet needs that I mentioned? So we have seen tremendous progress in the world in improving the lives of children over the past few decades, yet there are still unmet needs in all age groups. Well, firstly, the number of children dying before their 5th birthday has declined a lot between 1990 and 2015. But still, there are millions more preventable child deaths every year. As the global population keeps increasing, we will see the numbers still remaining in their millions. If we look at stunting, which is a form of malnutrition where children are not growing according to the height and weight that they should be, stunting prevalence among children under the age of 5 fell from about 33% to 23%, which means 43 fewer million children being stunted. Yet, we still have millions more who are. Globally, 32 million people died in 2016 due to cardiovascular disease, cancer, diabetes, chronic respiratory disease. The probability of dying from these causes was about 18% in 2016 for people between 30 and 70 years of age. So as the infectious diseases are coming down, as the profile is changing, we are confronted with a different disease pattern among the population. Unsafe drinking water, unsafe sanitation, and lack of hygiene continue to be major contributors, resulting in still hundreds of thousands of deaths. And they're mainly still due to diarrheal diseases, due to malnutrition. So some of our basic challenges still continue. In India, if we look at even the issue of accidents, road accidents, every year, hundreds of thousands of people die from road accidents, which means their families, their children, the parents are affected, and some who survive are, again, burdened with the disability that goes with it. Now, Vika talked about how many beds per person we have here, and also globally, we see that it's not just the bed availability, but it's the cost of healthcare. And 12% of the world's population, which is over 800 million people, spent at least 1/10 of their household budgets to pay for health services in 2010, up from 9.7% in 2000. So while technology is improving, while solutions are increasing, we still see that the health costs are increasing. And I think that's the point that we heard, that whatever innovation or technology we're looking for, if it is not bringing in cost efficiencies to the family, then we're not really progressing in the way we want. Ensuring healthy lives requires a strong commitment. The benefits do outweigh the cost, and healthy people are the foundations for healthy economies. It's estimated that if we spend $1 billion in expanding immunization coverage against influenza, pneumonia, and other preventable diseases, we could save 1 million children's lives every year. In the past decades, improvements in health and healthcare led to a 24% increase in income growth in some of the poorest countries. And just in India alone, we have found that by having in place safe sanitation, a family would be able to save up to 50,000 rupees a year, either in health costs which they don't have to incur, or preventing income loss or loss of days going to school. So the investment case, the economic benefit of healthcare and investment in healthcare is crucial. The costs of not preventing safe driving on the roads, use of tobacco and alcohol, and allowing our environmental degradation without proper healthcare and affordability, it pushes many people into poverty also. So it's really important that we not just see as what the opportunity costs are, but also what is happening to those who are not able to afford it. So if I look at my own organization, as UNICEF, we have a very ambitious agenda of reducing child deaths, reducing disease, reducing malnutrition, and we're really working very closely with governments and civil society partners in many countries around the world, in about 145 countries around the world, to look at what are the solutions that can be taken to scale so that we can be seeing the world as a better place for children. Core to our strategies and how we do it are three key areas that I'd like to highlight. One is leveraging the power of business and markets for children. It's not just about governments anymore. It's very much about how civil society organizations, the business sector, and the private sector are engaged. It's about fostering innovation in programming and advocacy for children. Like any long-standing bureaucracy, it takes us time also to really embrace new things, new technologies, new ways of doing business, but it is core to our strategy. And within all this, using the power of evidence to drive change for children. And I think that's where it's really important that whatever innovation and technology we take forward, we're very clear on measurement of is it making a difference or not. And if it's not making a difference, let's move on to something else. It's very important that we embrace failure, that we accept failure and move on, and not keep trying to reach the same end through a means that we know does not work. For UNICEF, it's really important that we see the world where health and well-being of children is improved through health systems that are also digitally enabled, in which the health technologies are used to enhance quality and reach, and that the services for the most disadvantaged children and their families. And I was recently in one of the tribal districts in Chhattisgarh, in Jharkhand. And there I saw in the Health and Wellness Center also they are looking at how e-health can be complementing the existing health services that are available. Again, it's a matter of how are we testing it, how are we measuring it, how are we looking at the return on investment that it takes. I totally agree with the fact that innovation has to be informed by human-centric design. So it's not just about a solution, it has to be a human-centric solution, something that takes into account the needs of people, that looks at an implementation strategy that has a system-wide view. And what would be the success criteria if we were to be looking at some innovation related to that? It would have to be, one, that it saves time and money. So making low-cost trials of innovation programs before scaling the solution, going in quickly, I think that is not an approach we would advocate. We have to be very clear about, before we invest in large-scale efforts, that we are very clear about the returns on that investment. The second criteria we would think of is that it is pro-equity, that we look at using technology for especially reaching the last mile, as we call it, the last mile of reaching people either who are geographically out of reach or who are socially out of reach. How do we get to them? That it brings in a systems view, not something in isolation, but can be connected. The fourth criteria would be looking at that it in itself helps bring about new solutions, that provides the opportunity for new thinking. And fifth, really looking at how we can close the empathy gap. And I think it's really about empathy, meaning having an understanding of the situation the other is in. So how can we reach that empathy gap through innovative solutions that would include technology too? I think India has taken the whole issue of technology and innovation to heart. The number of different solutions that we see every day coming up are really exciting and heartening. And I really believe that if we can look at coming to clear criteria on what the measures of success will be, it'll be very, very important that we do that. If we look at the challenges that are likely to be coming forward that need to be addressed, one is that we try to move away from verticals. A lot of our health innovation technologies have also become vertical, and then integration becomes a problem. So unless we step back and look at all the spheres that need a solution, and we already look at how they can be connected, how they don't become discrete, it'll be important that we do that. The second is creating the partnerships between different types of organizations, including service providers, drug suppliers, phone operators, IT platforms, etc. Looking at business models that combine markets, philanthropy, and government funding. It's really important that we not look at one source of funding that goes to it. Privacy and government capacity to analyze big data, to keep an eye on are things going in the right direction. I think that's, again, something that would not be sort of a crime issue, but really looking at how do we prevent such use of data becoming harmful for people. And then, of course, regulating the healthcare, drugs, and information technology so that we don't end up creating harm in the process. So I understand here we will have people from the public sector, entrepreneurs, startups, and all of you have a huge role to play in these priorities. You will be bringing together information on new and improved technologies, new delivery models, looking at pathways to address the problems. I would urge you also to look at the pathways to address these challenges in a sustainable manner, so that we don't move along and then realize that we haven't accounted for the challenges. It will be important that we have a suitable public policy to help the process. And, of course, the affordability. That's something I'll keep coming back to. Not just the immediate affordability, but the long-term affordability. India, with its vibrant technology and talent pool, has been leading the development of many products and technologies, so it's a great opportunity here. India already is a major producer of life-saving vaccines, medicines at affordable cost, and we have witnessed an explosion in the number of tools available to collect, filter, integrate, analyze, map, and visualize information collected from the field for leaders and for decision makers. The important part is, are we using that data? How are we using the data? Is it feeding back, and is it leading to improvements? And I think this is where we have to keep challenging ourselves. The emerging technologies represent an extraordinary opportunity to close the information gap. And it's really important that we keep that centered to it. So what can we all do to achieve these needs? We can start by promoting and protecting our own health. So I'd echo what the General said about what have you done for your health today. The health of those around us by keeping well-informed choices, and taking use of all the preventable behaviors and technologies that are available. We can raise awareness in our own community about the importance of good health, healthy lifestyles, and especially those who we see are more disadvantaged in society. We also, I think, as a community, we have to hold each other accountable for the commitments we make. And to improve people's access, and really to encourage everyone to, again, innovate newer and more affordable technologies, solutions, and ensure that public and private sector support the best of the brains. As much of the resources, both human and financial, can come together to really look at how we can be addressing prevention being better than a cure. Thank you very much.